Interest of time, I think we'll kick off. I'd just like to start by acknowledging the traditional owners of the lands that we're all meeting on today. I'd also like to pay my respects to elders past and present and extend that respect to other Aboriginal and Torres Strait Islander people joining us today for the teleconference. And for those who have just joined, my name's Lauren Dalton. I'm the Immunisation Liaison Officer here at NCIS. I've got Tracy Hibbard, the Director of the Immunisation Register with us, and Sarah Taekwon, the Assistant Director. So thanks everybody for joining us. There is a Q&A that we're just setting up at the moment. We're having some little Wi-Fi difficulties with our laptop access here, but you can post some questions and answers, and we will pause throughout the session by just clicking on the Q&A box on top of the screen. So you can do that. Any questions that we can't get to, we'll certainly take on notice and feed that information back to everybody. So thank you. I'll just hand over to Tracy. So welcome everybody.
Thank you. Thank you very much for having us. I too would like to acknowledge the traditional custodians on the land on which we're all meeting today, and thank you very much for inviting us to give this presentation. The Department of Human Services as a whole is changing the way that access to our system will work. The main driver, and it will be eventually organisation-wide, with the main reason being the security of personal data. So while some of this is a change, well, a lot of it is a change, and it will be a change for everybody, including we'll have to do it to ourselves as well as to everybody else. The purpose behind it is making people's personal data more secure. With that, we do get some extra functionality. So we'll go through the presentation. I really don't mind questions as we go. I'm not sure how the technology works, how we'll hear those, but we have people here who will sort that out for us. Or we'll have questions at the end if you miss an opportunity. There's quite a few people who have joined us, so we'll see how we go with that. I guess we'll start with what PRODA actually is. And I think if you're a Medicare provider at the moment, so any health professional with a Medicare provider number can already use what we call PRODA for individuals. You can use your PRODA sign-in, you can get onto HPOS, and you can access the airsite that way. The problem that we've had over the years, and why we're still on authentication file, is that there hasn't been anything other than authentication file for non-Medicare providers to use. So for all our ancillary providers, anyone who accesses the airsite who does not have a Medicare provider number had no choice except for AuthFile. But now that we have a much more secure system available, we will be moving from AuthFile to PRODA for organisations. So the main point with PRODA is that we will know, you'll have your own username and password. So Tracy Hibbard will be authenticated as Tracy Hibbard. We'll know that I have my own username and password to access our system. So there's lots of benefits that we'll go into later that come with that. But it makes sure that our, I guess, Medicare database and our citizen data is protected. So I've already said the benefits there are certainly better security. So similar to what you would with your bank account, you know, you need to have your password or your authentication updated regularly. This is how this it's assigned to a single person. And we know at the moment authentication files are shared. We know that some authentication files have been in place for up to 20 years. And over people moving in and out of organisations, we know that that has been shared amongst lots of people. So the idea being that single password, single person, we know who's entering our system, and we can then guarantee that our information is much more secure than it currently is. There is an online registration process, so gets rid of the paper. We've already started to do that, but it's moving much more to an online registration process. Access to the airsite from any internet connected device. So at the moment, the authentication file needs to be loaded onto a particular machine. To access the airsite, you have to be on that machine. That restriction will be taken away. So it doesn't work on mobile phones. The mobile phone screen is too small to accommodate the airsite, but it will certainly work from laptops that you might take out for immunisation clinics, for example. You'll be able to log on to that laptop and access the airsite using PRODA. The last point there, one person, one access. Again, little bit of a change with that, but one of the big benefits we were just discussing here is that if someone forgets a password or makes a mistake with a password, and then everyone using that WAN authentication file can't access the airsite, that won't happen anymore. So it'll be that if one person messes up their password, that person might, you know, depending how many times they've made the mistake, lose access to the airsite until they get a new password. Everybody else will still be able to use the air. The point at the bottom there, so cybersecurity, as you know, across government, across everything that you do, has become much more prevalent. So people need to be very, very aware about who's accessing what data, the reason that people are accessing data, and in line with that, and to keep us in line with the Commonwealth requirements for cybersecurity, authentication files will be switched off by June 2020. Now, we're not just going to do that without any information. This is the first of a number of presentations, of letters that you will receive, of information that will be available on our website to assist you with the process. And there is a process to go through, but once it's up and running, it works really well. But as I said, authentication files will be switched off, all of them, by June 2020, and we will have a process of getting to that point. We're not going to switch everyone off at the same time, but we'll be in contact with you and let you know what's going on with that. When you have access to PRODA and you come into our website, you'll be taken to HPOS, so Health Professional Online Services. And again, if you're a Medicare provider, you will already have access to HPOS. Again, it's a faster way to access the air, but it also gives you some additional functionality as well. So again, it's much more secure than what's being used at the moment. It provides a secure email functionality that will also allow you to add attachments. So we don't have that functionality in the airsite at the moment. If you send a secure email via the airsite, you can't add attachments, which is sometimes, well, in a lot of cases, difficult for a lot of organisations have been fantastic in letting us know when there's duplicate records, or if there is a single record with information across a number of places. Instead of sending us people's personal details insecurely, they'll be able to be added to the HPOS email. And depending on levels of access, you'll be able to update bank account details and a number of different business functions within HPOS, changing addresses and all that sort of stuff. That screen at the bottom there is what it'll look like, depending on who you are, depending on your provider type, depending on what access you have to our organisation. I'm talking all of DHS, any of the health professional programs. The tiles that the programs that you have access to will come up in that screen. So this one, just the air is highlighted. The processes to go through in setting up an organisation in PRODA, well, there's a number of steps. None of them are terribly complicated in actually doing the process. The complicated bit, I think, is having to think about things beforehand and making sure that you have the information that you need when you sit down to do the process. So that's part of what we're doing today and why we labelled the presentation Preparing for PRODA, so that you can have some time to do that thinking, to find the right people, to work out what your business model is and how you would like to set up your organisation. So the steps that we'll cover in the next hour or so, very briefly, I'm going to cover about registering for it as an individual. And the whole purpose of that is more about identifying, again, as I said, that Tracy Hibbard is actually Tracy Hibbard, that the person that we think is actually coming into the system is that person. Once we've registered everyone as an individual, the people with the right authority can register an organisation. Those people then can delegate various functionality to different members. From there, you can set up what we call sub-organisations, which I'll go into a bit more detail in a minute. You then link to a service to access the air. The service that you'll link to is HPOS, and then you'll link to the air after you've linked to HPOS. So the number of steps in the process. Today is about the thinking that goes on before you need to do that process. So registering as an individual is everyone's first step, and that includes all of us around the table. It includes anyone who is going to access a DHS program. What we've done here is set up a bit of a case study. So when we've assigned names to people to try and help you be able to follow through the process that we're setting up. So as I said, first step is creating an individual, and we've got Jane here. Jane is the director of an organisation, so she needs to go into the DHS website, to the PRODA part of that, and she'll be asked a number of questions and need to provide details. So her details, her log-on details, and then an email address that is appropriate to use for logging on for a work account. Once she's done that, Jane will be sent a verification code. So it's a one-time activation code, and it's basically the same as what you would do for setting up a Gmail account or your Google account or your Apple account or any of those things. It's basically a two-step process to make sure that the person who has said she's Jane, she's provided an email, we send a code back to her, she sends it back to us, it's been verified that that email is attached to the person who says they're Jane. So while it's a new process for what we're doing, it's a process that you've probably used a number of times for various functions that you already do. Once that has been verified, when this is done, you get what is called an unverified account. You will be given what we call a registration authority, which is kind of the same as a username. That's the number that you will need to keep, because that's what will get you connected as a member to an organisation. Is there any questions so far? Do you want to stop along the way for questions? They're not showing up on the screen here, so.
There is a question. Yes. So the question was, will the presentation be recorded and available? Yes, it will be. So the presentation is being recorded, and we'll make that available on the PHN website in the coming days.
Great. So we'll continue on. So once you've done that first part of the process, you have 60 days to verify your identity. Okay, to verify your identity, again, to prove that Tracy Hibbard is actually Tracy Hibbard, the best pieces of evidence to use are your driver's license, your Medicare card, and a passport. So you have those numbers, you have that information ready. This process takes about 10 minutes altogether. If you've got those documents ready to go. So those documents then get verified through the document verification system at the Attorney General's Department. It goes off, verifies that all that information is correct for me. So this is just identifying that Tracy is Tracy, or in this case that Jane is Jane at this point in time. If you don't go through that process in 60 days' time, the account gets removed. Oops, sorry. Okay, so we've done the verify. It's not moving on. There we go. We've got some things. It's actually showing up on everyone's screen. Sorry about that if it's being annoying. That's me with my lack of mouse control. Individual registration is complete at this point. So in this point, Jane has verified that she's Jane. All the documents have aligned. As I said, if you've got everything ready for that part, it takes about 10 minutes, sometimes less, depending on your internet connection. That part of the process will never expire. So Jane has a PRODA account now as an individual. That's hers forever. Then the next part in the process is registering the organisation. The organisation, as you know, all businesses and government entities are registered with the ATO. The ATO is responsible for managing the Australian Business Register, and on the Australian Business Register, you'll have the details for the organisation. They'll have the ABN, the Australian Business Number. And if you're a government entity, there'll be an authorised contact that is associated with that ABN. For non-government entities, for any other business, it's called an associate. These are just ATO terms at the moment. So the authorised contact goes with a government entity, and it's called an associate if you're a business. And it's the information that is aligned to the ABN that's registered at the Australian Business Register. So that is the level at which we are authenticating who's who. So does Jane, in this case, have the authority to act on behalf of her organisation? That is checked against the ABR. So Jane, in this case, will be presented with proof of record ownership questions, and they have to match the details recorded on the ABR exactly. So this is part of the process that you'll need to think about before you set up your organisation, is who is the authorised contact or the associate for your ABN, because that's how we verify that the right person is setting up the right business. Now, when it's a government, because of the way the Australian Business Register is set up, the ABN has an associate registered and available to see. When it's a government entity, the associate is not, sorry, the authorised contact is not readily available. So we can't go through the automatic process that businesses can. So we'll have to do this to ourselves. As I said, as a government agency, the Department of Human Services is going to have to go through this process, the Department of Health, State and Territory Departments of Health. Anyone who's listed on the ABR as a government entity will have to go through a manual process, because the person within our department with the authority to check the Australian Business Register will need to make sure that that authorised contact is the actual person responsible for the organisation. So what you'll do, this screen that's available now, you'll go through this process, you'll push submit, and basically you're making an error. So it'll bring up a screen that asks for manual assistance. I don't want to spend too much time on this part of the process. This part will be available on our website. There'll be user guides, there'll be screenshots and everything to follow you through this process. I'm just giving you a bit of a background to this, but the next part of what we're doing is having a think about how your organisation will be set up is the main bit of what we're covering today. So there's a few questions. We might just stop there.
Apologies to have to do it the old-fashioned way. Our Wi-Fi access here is absolutely dreadful. Okay, so the first question is, if your organisation is a hospital health service, is the lead person the CE of the hospital health service?
The question is maybe, or the answer rather is maybe. So that will be part of the work that you will need to do beforehand in going back and having a look. So when we met with Queensland Health and we were looking at the HHSs, in a lot of the cases it was a finance person who was responsible for the ABN. In other cases it was the CEO. So it depends how the organisation was originally registered with the Australian Business Register. So RA numbers, so a provider can have many different RA numbers depending on the authority, but only one PRODA RA number, that's correct. Have individual authentication files already been phased out? Not yet, but they will be very soon. So for new providers coming on board, in 2 weeks, they will not get an authentication file anymore. We haven't turned off any authentication files yet. What we had planned to do by the end of August was turn off authentication files for Medicare providers. In the meantime, we discovered that for PRODA when a provider logs on as an individual, so I'm Dr. Tracy and I'm a GP and I have a Medicare provider number, I can log on now using PRODA for individuals and I can get on to HPOS and I will have all the tiles available for the programs for which I'm registered. For everything else except AIR, Dr. Tracy can delegate to practice nurse Sarah the functionality within those programs. Because the AIR has only just recently gone through a lot of upgrades, you might have noticed that the screens on the AIR site, there was a difference until June. There were some in the really old look and feel, and then there were some in what looks like new screens. Because some of our screens were in that old technology, we weren't able to provide a delegation function. In June, we introduced and moved all of those screens from the old technology to the new. So they're all written in what is known as Java now. And that enables us to build that air delegation function. So we're in the process of going through that. We don't have a release date for the delegation function under PRODA for individuals. But as soon as that is available, we'll give people time, and then we will turn off the authentication files for the Medicare providers. We're not going to do it until people have something to go to, though. So we do understand that it's difficult in those situations. So next question is, will the slides also be available for downloading? So that at the moment, because we're going through, this is a really new presentation, we're learning along with everybody else. We're releasing for PRODA in a couple of weeks' time. I would prefer not to do that at this point, mainly because any feedback that we get will update the presentation to make it really, it's about version control, I guess. If we get lots of questions, then it's better that we add a new slide in that covers and answers those questions. So to keep it up to date, it'll be available on the portal, but not available for downloading. Next question is, what if the person who set up the ABN or is no longer with the organisation? So that part is totally out of our control. So that there'll be some work to be done in your organisation then to make sure that the Australian Business Register is up to date so that your organisation can be verified. So we can't do anything other than use the Australian Business Register. You have to make sure that that's correct. Yes, they will. So everything will be fine. All authentication files will be turned off on 30 June next year. Keep going. Okay, so we've covered that with the slide about having to go manually when you're, so if you're a business that is not a government entity, you can go through this process and register everything online. It's just the government entities that will require manual assistance. Organisation registration is complete once you've gone through that part of the process. So the actual process of registering the business is not the difficult bit. The bit that will require a bit of thinking is how you set your organisation up in PRODA. So at this point in time, we've got Jane. She's the authorised contact. She's been made the director role in PRODA. So now we can go forth and start setting up her organisation. So as the director of a large organisation, Jane may have lots of sites and lots of people and lots of different functions within her organisation. So for my organisation, for example, the Department of Human Services, the secretary of an organisation with 32,000 people is the authorised contact. So it's highly unlikely that our secretary will do anything more than sit down, register the organisation, and then she's very likely to delegate those functions of setting up the rest of the organisation to other people. So you need to think who those people will be. And again, depending on your organisation, you might not delegate. It might just be a single person. If I had Tracy's Health and I had a few doctors working for me or a few nurses working for me, I might decide to keep all those functions to myself. Large, complex organisations may very well delegate those functions immediately. So there's a few things that I would like people to think about before you add any members or you delegate any functions to people, and it's the law. So we have the Australian Immunisation Registers Act, and it is very clear about who should be accessing the air for what reasons. Also, I'd like people to keep in mind that the data that you have access to, as you saw at the beginning of this process, is people's personal data. You have their first name, their last name, their address, their date of birth, their Medicare card number. That is, as you've just seen, you're able to create individuals with that here. You're able to create a whole pile of identity with the Medicare number. So anyone who has access to the Medicare number and then other information as well needs to be very aware that you're doing it under the Privacy Act, and you have to follow the instructions within that. or else we are, it's same as I'm held to account, everyone who has access to the air is held to account under the Air Act and the Privacy Act. So do keep in mind who has access, should they have access, just because they always have, doesn't mean they should continue to. What is their reasoning for accessing the air? So those, and the next part of here is those people with the director role who have the appropriate attributes in PRODA can add members to the organisation. We'll go into a little bit in the middle about what the attributes are and what they allow people to do. So just think about those things before you go too far. When you add members, if you're the person responsible for adding members to your organisation, you will need the person's RA number and their surname to be able to search them in our system. So the screen, and again, I won't go into a lot of detail about what it looks like. It's just, I know some people's brains go down to the detail of you. What you need to do though to add a member is you'd click on members, and then the screen just looks like that. It's pretty simple. You have an RA number, you put in the surname, you push search, they come up in a drop down, you highlight them and you add them to your organisation. So again, the actual process, this part is not complicated. The thinking that goes into before though is the important bit. So these are the different attributes that are available in PRODA. The first one is owner access. Jane, as the director of the organisation, has owner access. She can also delegate that to other people within the organisation, and it basically gives full access. Sub-org management. So within PRODA, there are only two levels of organisation. We have what is called a parent organisation. So in my department, the parent organisation is the Department of Human Services. Underneath that though, we're allowed one layer, and it could be that there is a number of programs or a number of businesses, or in a hospital case, you might have the hospital at the highest level at the parent organisation if they have an ABN, and then you might have wards within a hospital under there as sub-orgs. So this attribute is giving someone the power within our system to create sub-organisations. The attribute of employee management is allowed to bring people, add members to the organisation. And the service link is being able to provide those people who have already been added to an organisation link to, in our case, HPOS. So keep in mind that this is for all of the Department of Human Services though, so there could be a number of different services that need to be linked. So if you were a local government or a local council, for example, you might have childcare associated, you might have aged care, you might have health services, and under health services you'll have a number of programs. So keeping in mind that when you build these organisations, the first, while AIR is going first and immunisation is the first program to use this, it will be used for Medicare, it will be used for PBS, it will be used for aged care. It, as an employer, it will also be used for other various Centrelink programs. So there's a lot of services that will eventually be linked to the organisation. AIR is just the first one. So in our case, we continue with our case study so we can put that into practice. Jane is the director. She's going to add 2 people to her organisation to start with at the parent org level. And in this case, she's adding John, and she's giving John full access to do basically her function. And she's adding Jim, and she's making Jim an employee management. He's allowed to just add members to the parent org or the sub-org, whatever level he's at. Now, there's a few things to think about here when we start thinking, who are we going to bring on and how are we going to set up our organisation? At the moment, we know that a number of organisations have, in some cases, lots of vaccination provider numbers because they needed to be able to manage who accesses the AIR. So you have a provider number that comes with an authentication file and a password, and you might decide, or your organisation, one of our organisations we know had up to 10 provider numbers because they wanted to be able to manage very carefully about who had access to which information. So you might have currently set up a data team has a provider number, and people who put who record vaccinations have a different one. People who run reports might have a different one. You don't need to do that anymore because you won't be sharing usernames and passwords. So before you even think about how you're going to set up your organization, think about how you would like to set up your organization. And what I would like you to think about is not just how you put the information in, but how you get your information out. So how do you run reports? So for a hospital, for example, do you want to be able to run reports based on your emergency department, what immunizations have been given there, or your maternity or your oncology? You may very well have different provider numbers for different wards. You might be in a small hospital and just have one provider number for the whole hospital. So have a think about how you want your data out as to how many provider numbers you need to put data in. And the next thing is about what level the provider number is. Again, if you're a small organization, your parent org might be all that you want and need, and you just have your provider number at the parent org level, or you might have your provider number at the lower level. The other thing to consider is about onboarding and offboarding staff. So at the moment, we know that in some organizations, the same authentication file and password has been used literally for 20 years. And we know that staff start and staff leave. And at the moment, they could have access to the authentication and password, which is, again, part of the reason why we're doing what we're doing, is to make sure that the individual accesses what the individual should while the individual is employed where they're meant to be employed. So have a think about all of these things before we move on. There's a number of questions. Shall we? Do you want to? Can more than one person use the same email address? No. One email address, one person. Is there a commencement date from which we can register an organisation? So the functionality will be available in 2 weeks' time. I would suggest you don't go on straight away. As with any IT implementation, we generally take a couple of days to test it ourselves. So it will be going live on the 12th of October. But we'll be in the system and doing a lot of testing for that first week. So I would at least leave it until after that. We are going to do it to ourselves first. And like I said, my team, as well as Federal Health, will be building their own setting up their own organisation, just to make sure that if there's any bugs, we will find them first. But from that point onwards, it'll be available for people to set up. Okay, so moving on with our case study. So we've got a parent organisation. Jane is the director. She's given owner access to John. Both of those people can build sub-orgs. So because they've got full functionality, they can build the sub-organisation. So when we were with Queensland Health a couple of weeks ago, you might have, so the example that we used there was Townsville HHSS was the parent org. And then under the sub-orgs, you can build, we know that, I can't remember exactly, but 10 or 12 hospitals all sit under the ABN for Townsville HHSS. So you need to have a think in this case about, again, like how you do want the data out. In their case, they were thinking maybe Mackay Hospital would be sub-org A. It might be that Townsville Hospital uses a number of provider numbers because they want their data out under the different wards within a hospital. So they might have sub-org B, C, D, E, F. There is no limit to the number of sub-orgs that you can have. And just because you build one doesn't mean it has to stay forever. You can build it small to start with, and then you realize you need something more, that's okay. You can also delete them if you need to. So once either of those people, because they're at the parent organisation level and they both have owner access, they both get added to all of the sub-orgs. So again, keeping in mind who are the right people to have that owner access is really important, because they'll have access to all the lower levels. Once we have the sub-org set up, the next part of the process is having a look at who should be added, which members are we going to add to each of the sub-orgs. Who's going to be responsible within that sub-org for managing it. So if you're looking at something like an emergency department, or if you're looking at a local council, or whatever it is that you're looking at, do be aware that the people that you have here will need to onboard and offboard. They'll also having to be responsible, making sure that the people are very aware of their responsibilities under the AIR Act and the Privacy Act. These people have information access that, you know, most people in the country don't have. So I'm being very, very particular about being aware of your responsibility of managing private information. And I'm sure everybody is, but I think sometimes in some of the conversations I've had recently, people forget that with a Medicare, as I said before, with the Medicare number and the information that's in the air, you can actually do quite a bit of damage if it's allowed out of the organisation. So keeping in mind who has access to what, those people can start adding members. So in this case, we've given Fred and Mary employee management access. That means they can go in, and to those screens that we had previously with an RA number and a surname, they can start adding members to their organisation. When you're doing this, also keep in mind, are these people, you know, I would advise not just have one person at that level. Someone goes on leave, who's going to manage the onboarding and offboarding? So all of those things need to be considered. Is it more appropriate to be an HR department? Is it more appropriate to be an IT department? Whatever happens within your business model is something to consider about who has access to what and who is going to be responsible for the members. Now, can we get rid of that screen at the top? I'm not sure why that is disappearing, but basically the heading up there is about linking to service providers. Now, in our case, we're going to just use a couple of examples, but there's lots of service providers. The one that you will need for air access is HPOS. So HPOS in this terminology is called a service provider. The other one that we're using there as an example is CCS, so it's a childcare subsidy. A lot of our organisations are already set up for childcare subsidy. That became available in July last year. So there may be, especially if you're a local council, may already have PRODA already set up. They may already have a sub-organisation set up, and they may already have access to CCS. You can add then HPOS for this purpose. I guess the demonstration here too is that a sub-org can have multiple service providers or one. So it depends on who you are, what business you're doing with our organisation. So the different service providers, and this is just a short list of some of that are available at the moment. As I said, there's childcare subsidy, there's the National Redress Scheme, HPOS will be your link to any of the health services, and then there's the Centrelink Business Online Service. So the B Hub is the business hub for Centrelink. So in our case, we want access to HPOS. So Jane's organisation gives immunisations. So she's going to set or make a link to HPOS. To do that, Jane will need the organisation's air provider number. And again, something to keep in mind, just because you have multiple air provider numbers, it doesn't mean that you're going to have to keep them all in this process. You can, if you want to, and use them at the sub-org level. But what you might find is that you have the ability, especially in larger, more complex organisations that have had, again, like I said before, you have lots of provider numbers because that's what you needed for the auth file access. You don't need, well, depending on how you want to set up your organisation, you may not need that anymore. But you will need a provider number, and you'll need to answer some proof of record ownership questions with that.
We're just going to try and get rid of this top screen.
That's okay. I thought if I could. Thanks. Okay, so I guess the point here is something to note is that when Jane registered her organisation with the AIR, which may have been a long time ago, she will have received 2 letters. One would have been the provider number and one would have been the linking code. You're going to need that information to link to the AIR. So you'll need for HPOS. So if you remember back to the screen where there were 6 steps in the process, we're nearly there. This is the second last step where we've linked HPOS. Then you will need to link the AIR. So you'll need that information to do this part of the process. So again, depending on your organisation, you'll have different information. So the steps in the PRO, the proof of record ownership, requires you to have the postcode of the business or your government entity, as well as the AIR provider number. You'll need the AIR linking code. And then depending on whether you have bank account details registered with us, the questions change slightly. So if you don't have bank account details with us because you're not a provider that gets paid, you move straight down to the other questions and off you move on to getting linked. Otherwise, you will need to provide your BSB and account number. Once that process is set and you've linked to HPOS, you can then go through the process of linking to the AIR. Again, anytime anyone has access to the AIR, it'll be on every screen, it'll be everywhere, is about keeping in mind the Australian Immunisation Register Act. And again, I know I will always keep saying this, but I think with the use of the authentication file and the sharing of information that you had to do, I'm not disputing that, and we haven't had anything else to use, but now that we have PRODA, we need to start thinking about people's privacy and the management of private information every time before you add anything. So in this case, I guess what we're trying to demonstrate here with this slide is, and I think one of the processes, and we've just worked through it here with the people from NCS and what you would do for PHNs, is get on a whiteboard or get a piece of paper and draw how you think your organisation will look. Keeping in mind the parent organisation is the ABN level. What organisations or what sub-orgs sit under that, and then who has access to what. When you add members to either an parent organisation or sub-organisation, you can give people access to multiple service providers. So if I'm an HR department for a local council, I may very well have access to HPOS and childcare subsidy. I might also need access to the Centrelink Business Hub. So as an individual member under sub-org A, I could have access to one or more than one service providers. And that's okay. Because keep in mind, in some organisations, that may very well be the HR department. It could be the finance department. It could be whoever it is that you decide should have that access. I think that's just what I would like to do now, is open up for questions from this particular point. There's a couple of things, I guess, that I haven't mentioned. One is that if I were Nurse Tracy and I work across a number of local councils, I could be employed to deliver an immunisation program. And I know in Canberra this happens a fair bit across a number of health centres or health areas. They might be set up as separate sub-organisations. And what happens then when I register for PRODA for individuals, I've got my RA number. I would give that RA number with my surname to the person setting up the sub-org. And it might be that I need to be a member of 4 or 5 sub-orgs, and that's okay. So the person responsible for employee management for those sub-orgs would go in and add me to each of those. Then on a particular day when I log into PRODA, I would get a drop-down screen and it would have those various organisations for which I've been added. And I would choose on that day that I'm working for Greenway Local Council. And I'd click on that one. That's the access that I would have on that day till I log out and go back in and log in as something else. Might be doing a morning in one clinic and an afternoon in a different clinic. So I can log in and out and change those provider numbers for which I'm giving immunisations or getting reports from the AIR. We have a look at questions. Okay, what if the organisation does not have the information originally received with the provider number and link? In that case, you're going to have to call us. So if you call the AIR, we'll give you the information and the right numbers to call for the right type of questions, I think would be the answer. I'm not sure if we've got that quite ready to go yet, but that's part of the work that we're doing over the next 2 weeks, making sure the right number for the right questions. Generally, it will be the airline that you normally call, and we'll be able to provide that information for you. Again, but you will have to, before we do that, I'm just keeping in mind, you'll have to provide us proof of that you are part of that organisation. So that's some of the things that we were talking about with Lauren previously. So on the PHN that she used to work for, she is still registered with the AIR as the contact for that organisation. So in some cases, there's going to have to be a bit of an audit or a cleanup about who is listed as the contact person and who has the right details. And that's why we're doing this presentation now, so that you have a couple of weeks to have a think about, find the information, find the right people, get in contact with us. In this case, remove Lauren and put the right person in as the contact of the PHN, sorry. Can individuals under the same sub-org have different levels of access? Example, nurse unit management at sub-org. So I think I'll answer that in a separate way. So the sub-org will be the level that the provider number is at. So your AIR provider number comes with a provider type, and depending on your provider type, you have different access within the AIR. So for the purposes of PRODA, you can have different organisation and management, but for the access to the AIR, it is at the provider level. So I think there's two things to keep in mind. Is PRODA is just your access. It's just the key to get into the AIR, and it's managed quite differently to the access that you have once you're in the AIR. Does that make sense? So yeah, anything to do with the provider number will be exactly the same at the moment. If you have access to various reports and various functionality within the AIR, you will continue to have that based on your provider type. Will an individual have different provider numbers if immunising in different organisations? An individual, so we're talking about provider numbers being at the organisation level. So you could, as an individual, as I said, Nurse Tracy will have, might be made a member to different organisations, and those organisations have different provider numbers. But the PRODA aspect, you'll have one RA number, one password, and you will have, if you've been added to different organisations, you will have access to those different organisations. I can't see any need for an individual to have different provider numbers. If the parent org is the HHS, are the sub-orgs and the hospitals under the HHS, or are they individual departments? Again, this is going to be part of the thinking that you need to do in how you want to set up your organisation, and it will depend on your business model. So if you want information out of the AIR by the ED department, by the maternity unit, by the sexual health clinic, then you'll need a different provider number for those, and they will sit at the sub-org level. That's up to you how you want to manage your data. So I think that is the best way at this point to look at it. Is the AIR is basically it's a database. So it's about data going in, data being managed, and data coming out. So how do you use that data that's coming out? So there's choices there, and it might be that you set it up singularly to start with, and then you decide that that's not the way to do it. I know there's a couple of hospitals, Canberra Hospital is looking at doing some research from who is getting immunised in the maternity unit. So they very clearly want to provide a number for the maternity unit because they want to manage data going in and out at that level, at the sub-org level, because it will all obviously fit under ACT Health. Will nurses in GP clinics need an email address linked to that organisation? No. So when you register as an individual, the email address is for you and your individual access. So that's your, as I said, remember, PRODA is the key to get into HPOS. And if you're managing it as a clinic, so there's two different ways and two, I guess, different business models with GP clinics. If you have a clinic and all the GPs are recording their immunisation separately against their own provider number, then you'll need to wait for that PRODA for individuals delegation to come up. So Nurse Tracy works for Dr. Lauren. Dr. Lauren will be able to delegate to me as an individual, and I would then log on and it would all come up under Dr. Lauren's GP provider number. If it's Lauren's Health and we are registered as a clinic, as an organisation, then I'll still log in as an individual, but I would have been added as a member to that organisation. So just read the rest of that. We are getting comments stating they don't have a work email and asking if they're going to have to log in through their home email each time they want to log in. So the answer is no, they don't do that. They get the RE number and a password. Obviously, this is not a secure, appropriate email. Exactly, yep. And yeah, so I think that answers that question.
Thanks, Tracy. It's Lauren here, everyone. There's no more questions, but if you've got some more coming, please write them in and we'll review those. But I actually have a question now, and I guess from a practical sense. So what do you suggest for people working in a PHN now? So in my experience, I've worked at a PHN. I would think in the most cases for those working in PHNs who are on the line that you only need a parent organisation, that hopefully the CEO or the chief finance officer is the holder of the ABN number. And you may not need sub-organisations. What steps do you want them to go through now?
The first part of the process is having a look at what level your ABN is and finding the appropriate people with the right information so that initial registration process can go really smoothly. As I said, it doesn't take very long if you've got the information ready to go and you've done that thinking beforehand. Again, how you set up your parent organisation and your sub-org depends entirely upon how you want the data out. If you as a PHN don't mind all the information for your PHN being recorded and being accessed under the one provider number, then just have the one provider number and keep it simple. So there's nothing wrong with keeping it simple to start with, and then down the track you realise that I'd like a sub-org for this reason. That's perfectly fine.
So in terms of that now, people can obviously get that information. They can register individually for PRODA using their ID and go through that step. And in a couple of weeks when it goes live, if they've got all that ABN information correct, they can start registering their organisation. Yes.
I guess one of the things there, and that I think was Lauren's point that I missed, was about registering for PRODA for individuals now. There will be a lot of people registering for individuals as this process goes on. So as I said, while AIR is the first program within the health services to move to PRODA, it will certainly be across every part of our organisation in the not too distant future. If you use practice, so this is very clearly at the moment just for direct access to the AIR site. If your organisation uses software, practice software is being updated and the PRODA access through the software will be managed by the software company. So you don't have to worry about it for that purpose. But because of the way information in and out of the AIR works at the moment, to get a person, so to get Tracy's full immunisation history, you have to log on to the AIR to get my immunisation history, identify an individual. That's when you will use this process. This process is completely different for software. So don't worry about having to set this information up. It's for your software. The software vendor will worry about that bit. This is just for now for this part of the process. Another question's come through with organisations such as Queensland HHSs have been notified of the changes in who by, and are they going to receive any information on why, how, when this all needs to be finalised? Yeah, we've been working quite closely with Scott Brown and Jane Sanders and the team from Queensland Health. We initially tested this presentation and process with them. And we do understand that, you know, there's 16 HHSs in Queensland, and they're run a little bit differently. So we certainly have some BDOs in Queensland as well that will help you through this process. And we'll be working with Scott and his team over the next couple of weeks to make sure that you have the information that you need.
It's Lauren again. We've got a couple more minutes, but if any other questions come through, but just to sort of make another point. So as I was explaining before, I've worked at a PHN and we were thinking about different models that PHNs use. And just for those who might be interested, I work at NSIS, obviously. We sit under the umbrella of the Sydney Children's Hospital Network. So we were just doing a little whiteboard activity before about our organisation. So our parent organisation is the Sydney Children's Hospital Network. The Westmead Children's Hospital sits under that, as does NSIS and as does the Children's Hospital at Randwick. So we were looking at those three as sub-organisations, but then also thinking, okay, at the Children's Hospital at Westmead, we have the immunisation clinic, and we also have emergency ward, and we also have the ICU team. So just thinking about who is giving immunisations and recording immunisations in your environment, and what organisation, as Tracy was sort of saying, at what level do you want that data to be extracted in reports, and then thinking that way in terms of how and how you might want to set up sub-org. So we were sort of just doing a brainstorm. So for those who are keen to get started, that might be a good sort of first step. I think there's one more question coming up.
Should individual end users start applying and registering now in anticipation of our parent organisations? I would say yes. So certainly the individual part of the process. Most people are able to go through that process really quickly and easily electronically. It takes less than 10 minutes. If you've got all the documentation. If you don't have all the documentation and you require a phone call to our department, they've been great. At the moment, there's lots of people available to assist. But I imagine in a couple of months' time, when this gets moving a little bit more, it might be more difficult, or it might be a little bit of waiting time for assistance. So the earlier that we can get people on as individuals and get that part of the process done, the better. When will PHNs be able to access PRODA? So as I said, it goes live on the 12th of October. If you can give us a week to do some testing and doing it to ourselves, as I said, I'd really like the opportunity for our own department, the Department of Health, to go through this process. But after that, it will be available for PHNs to access. And we're running through some training programs with the Air BDOs. So if you've already got the Air BDO within your state as your contact, they will be a great source of help for you as well. As a PHN person, we're having issues with unusual name of their identification, or their identification does not match their professional details, and having trouble supporting them to register. I guess that the point of this is that you have to have the right information. If you give our PRODA team a call, they'll be able to help you through this process. But the whole point is that you have to have the right name with the right person. And it's sometimes some of your identification, we've had people with who have changed their names, or people who are known by a different name. You have to go back to the name that is registered either on your passport or with Medicare. The Medicare part is a problem for some people because we know that they use a common name, but what name did you register with Medicare will be the name that you are required to register for this part of the process. The next question is, when will local government immunisation providers in Victoria be going live? Be going live in PRODA, I'm assuming. Local government, the same date. You can start registering, I would say the week after. So from any time the week of the 21st of October onwards, you can register. You don't have to register straight away, but because keeping in mind some of this might be a bit of thinking, gathering the right information, but from that time it will be available to start building and making your organisation.
I think that's sort of the end of the questions, and I think we've had quite a lot of questions, and I think that's been great, and we can certainly extract these questions, provide them to Tracy and her team, so they can look at their presentation going forward and incorporate any of those things in there. I'll just look at any last questions there, but I'll just hand it back to Tracy. But thank you everyone for participating, and just hand it back to Tracy if there's any more closing remarks she'd like to make before we close the webinar.
Something to keep in mind, Sarah's just reminded me, is that you don't have to move straight away. So as I said, the PRODA for the authentication file will be shut down on the 30th of June next year, but you have until then to move. There will be ongoing discussions, forums such as these. There'll be more information becoming available on our website. There will be letters sent to providers in anticipation of the way we were looking at it is if we're going to support providers and have enough internal people to support providers moving, is that we would stagger the implementation of PRODA for organisations. So the first group off the rank is, as I said, we're doing it to ourselves first, state and territory departments of health, PHUs, PHNs, in anticipation that we are the group that are going to be likely to support the next group of providers. So if we're looking at rolling out the PRODA implementation, and as we do that, we will send letters to the providers who are the next group that we'll be focusing on, and we'll make sure that there's plenty of information available to you on how to go about this process. As I said, this part of the presentation is to have that thinking time before this happens, so you can do your whiteboard session, you can get out and have a think, you can find the information, you can find the right people, you can have a think about who is going to manage that onboarding and offboarding. So if you can do that at the moment, and then we'll be in contact with you about when you have to move and provide what support we can to help you through the process. I think that's about it though. If there's no more questions, thank you for your time. I'm hoping that's been a bit helpful, but certainly have a think and then get back through Lauren and the portal with your questions, and we'll be answering those for you as soon as we can. Thanks.
I'd just like to thank Tracy and Sarah for coming to Sydney for the day and delivering this webinar. I think it has answered a lot of questions. So thanks to everyone for their time participating, and particularly to Tracy and to Sarah for putting the presentation together. As Tracy said, we're certainly happy to take questions from or through our portal or directly through myself or through Cheryl. So please feel free to send those forward. And we have regular fortnightly discussions with the team at DHS and can sort of put these commonly asked questions to them and get some advice back to everybody. But certainly as we learn from this experience, we're happy to share those insights with people, and any sort of tips and tricks that we come across, and any bugs that we find or difficulties that people might be having, that then we can share the ways around that to others, then we'll certainly do that. So I'd just like to acknowledge everybody for their time. Thank you. We will have the recording online in the coming days, and I'll let everybody know about that. But thank you everyone, and good afternoon.